Blueberries are edible fruits from the Vaccinium angustifolium plant. Blueberry is a common food and is also sometimes used as medicine. Blueberries are high in fiber, which can help with normal digestion. They also contain vitamin C, other antioxidants, and chemicals that might reduce swelling and destroy cancer cells. People use blueberry for aging, memory and thinking skills, high blood pressure, athletic performance, diabetes, and many other conditions, but there is no good scientific evidence to support these uses. So in this video, we are going to discuss avoid blueberries if you are on these medications. But before starting the video, be sure to smash the like button and subscribe to never miss out on any of our videos. Number 10. Medications for diabetes. Blueberry leaves might decrease blood sugar. Diabetes medications are also used to lower blood sugar. Taking blueberry leaves along with diabetes medications might cause your blood sugar to go too low. Monitor your blood sugar closely. The dose of your diabetes medication might need to be changed. Blueberries are generally considered a healthy food, but they may interact with certain medications for diabetes. Here are some reasons why. Blood sugar control. Blueberries are high in fiber and antioxidants, which can enhance the effects of diabetes medications, potentially leading to hypoglycemia. Increased insulin sensitivity. Blueberries contain anthocyanins, which may increase insulin sensitivity, potentially enhancing the effects of diabetes medications. Number 9. Chemotherapy drugs. Blueberries are generally considered safe to eat, but they may interact with certain chemotherapy drugs. Some chemotherapy medications, such as bleomycin, can cause a condition called bleomycin blueberry syndrome, which can lead to increased risk of bleeding and bruising. Additionally, blueberries are high in antioxidants, which can potentially interact with some chemotherapy drugs that rely on oxidative stress to kill cancer cells. However, the exact interactions are still being studied and are not fully understood. If you are undergoing chemotherapy, it's always best to consult with your healthcare team or a registered dietitian for personalized dietary advice. They can help you make informed choices about your diet and ensure your safety during treatment. Number 8. Glucose 6-phosphate dehydrogenase G6PD deficiency. G6PD is a genetic disorder. People with this disorder have problems breaking down some chemicals in food and drugs. One or more of these chemicals are found in blueberries. If you have G6PD, check with your healthcare provider before eating blueberries. Blueberries may interact with statins, cholesterol-lowering medications, in a way that could lead to muscle damage, myotoxicity. Statins, such as atorvastatin, Lipitor, and simvastatin, Zocor, can already increase the risk of muscle damage, and consuming large amounts of blueberries or blueberry products may enhance this risk. The high fiber and antioxidant content in blueberries may increase the metabolism of statins, leading to higher drug levels in the body and potentially causing muscle damage. Additionally, blueberries contain a compound called bergamottin, which can inhibit an enzyme that breaks down statins, further increasing drug levels. Number 7. Surgery. Blueberry fruit and leaf might affect blood glucose levels and could interfere with blood sugar control during and after surgery. Blueberry might affect blood glucose levels and could interfere with blood sugar control during and after surgery. Stop using blueberry at least 2 weeks before a scheduled surgery. Blueberries may increase the risk of bleeding during and after surgery, so it's recommended to avoid them before and after surgical procedures. Here's why. Vitamin K. Blueberries are rich in vitamin K, which can increase blood clotting and potentially interact with blood-thinning medications used during surgery and anticoagulant effects. Blueberries contain antioxidants and flavonoids that may enhance the effects of blood thinners, increasing the risk of bleeding, platelet function. Blueberries may affect platelet function, which could lead to increased bleeding or bruising during and after surgery. Number 6. Pregnancy and breastfeeding. Blueberries are generally considered safe for most people, but during pregnancy and breastfeeding, women should exercise caution due to the following reasons. During pregnancy, high doses of vitamin K. Blueberries are rich in vitamin K, which can increase blood clotting. High doses may interact with blood-thinning medications or worsen blood clotting disorders, uterine stimulation. Blueberries contain a compound called bergamottin, which may stimulate the uterus and potentially cause contractions, potentially leading to preterm labor. While during breastfeeding, allergic reactions, infants may be allergic to blueberries or their compounds, which could cause an allergic reaction or intolerance symptoms. Interaction with medications. Blueberries may interact with certain medications such as blood thinners and pass through breast milk, potentially affecting the infant. Number 5. Blood thinners. Blueberries are rich in vitamin K, which plays a crucial role in blood clotting. However, this can be a concern for individuals taking blood thinner medications such as warfarin, Coumadin, apixaban, Eliquis, rivaroxaban, Xarelto, dabigatran, Pradaxa. The high vitamin K content in blueberries can potentially interact with these medications, leading to reduced efficacy, Vitamin K can counteract the effects of blood thinners, increasing the risk of blood clots. Increased risk of bleeding. High vitamin K intake can also increase the risk of bleeding, especially if blood thinners are taken in combination with other medications that also increase bleeding risk. To avoid potential interactions, individuals taking blood thinner medications should consult their healthcare provider or pharmacist about safe fruit choices. Monitor their vitamin K intake from all sources, including food and supplements. Consider alternative fruits lower in vitamin K, such as strawberries, grapes, or bananas. Number 4. Antidepressant. Blueberries are generally considered safe, but they may interact with certain antidepressant medications like MAOI, monoamine oxidase inhibitors. Blueberries contain tyramine, an amino acid that can interact with MAOI antidepressants, such as phenelzine, nardole, and tranylcypromine, Parnit. This combination can lead to a dangerous increase in blood pressure. SSRIs, selective serotonin reuptake inhibitors. Blueberries are rich in antioxidants and flavonoids, which can enhance the effects of SSRIs, such as fluoxetine, Prozac, and sertraline Zoloft. While this may seem beneficial, excessive antioxidant intake can also lead to serotonin syndrome, a potentially life-threatening condition in St. John's wort. Blueberries may interact with St. John's wort, an herbal supplement often used to treat mild depression. This combination can increase the risk of serotonin syndrome. To avoid potential interactions, individuals taking antidepressant medications should consult their healthcare provider or pharmacist about safe fruit choices. Monitor their tyramine intake from all sources, including food and supplements. Be cautious when consuming large quantities of blueberries or blueberry products. Number 3. Blood pressure medication. Blueberries are generally considered safe, but they may interact with certain blood pressure medications. Here's why. Potassium content. Blueberries are high in potassium, which can increase blood potassium levels. This can be a concern for individuals taking certain blood pressure medications such as ACE inhibitors, lisinopril, ARBs, losartan, potassium-sparing diuretics, spironolactone, increased risk of hyperkalemia. Elevated potassium levels, hyperkalemia, can lead to cardiac arrhythmias, muscle weakness, and other complications. Enhanced blood pressure lowering effect. Blueberries' potassium content and antioxidant properties may enhance the blood pressure lowering effects of medications, potentially leading to hypotension, low blood pressure. To avoid potential interactions, individuals taking blood pressure medications should consult their healthcare provider or pharmacist about safe fruit choices. Monitor their potassium levels and blood pressure regularly. Consume blueberries in moderation. 1/2 cup or 100 grams per day. Number 2. Antibiotics. Blueberries may interact with certain antibiotics, reducing their effectiveness or increasing the risk of side effects. The high calcium content in blueberries can bind to tetracyclines such as doxycycline and minocycline, reducing their absorption and potentially leading to treatment failure. Additionally, the fiber and antioxidant properties in blueberries may enhance the metabolism of fluoroquinolones like ciprofloxacin and levofloxacin, which could result in reduced efficacy. Similarly, blueberries may increase the metabolism of macrolides such as erythromycin and azithromycin, potentially reducing their effectiveness. To ensure the effectiveness of antibiotic treatment, it's recommended to avoid consuming blueberries or blueberry products during the treatment period. Instead, opt for alternative fruits lower in calcium and fiber like bananas or grapes. Blueberries may interact with certain antibiotics, making them less effective or increasing the risk of side effects. Number 1. Statins, cholesterol-lowering drugs. Blueberries may interact with statins, cholesterol-lowering medications, in a way that could lead to muscle damage, myotoxicity. Statins, such as atorvastatin, Lipitor, and simvastatin, Zocor, can already increase the risk of muscle damage, and consuming large amounts of blueberries or blueberry products may enhance this risk. The high fiber and antioxidant content in blueberries may increase the metabolism of statins, leading to higher drug levels in the body and potentially causing muscle damage. Additionally, blueberries contain a compound called bergamottin, which can inhibit an enzyme that breaks down statins, further increasing drug levels. Let us know your opinion in the comment section below. This was all for today. Hope you liked the video. Do not forget to subscribe to our YouTube channel. Stay safe, and we will be back soon with another video.